Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you have chosen to spend some time with us. We're looking forward to sharing with you important information that should help your family. Without further ado, turn it over to our founder, Dr. Randall Maxey.
Thank you so much, Dr. Barbara Nabert Stevens. I always get the Nabert right. I sometimes forget the Stevens part. And hello, Dr. Ivan Walsh at the County Fair. And welcome to everybody, including our special guest, Dr. Hewlett. As you know, the Black Health Trust was originally started during the beginning of the pandemic, and we've been on continuously for the past, is it 3 years, Dr. Nabert Stevens?
Yeah, I think it might be. This is May.
Okay. And we've turned to do more health disparities. And we have an interesting topic today, which is going to be introduced by the smartest man on the East Coast. And you know why I say that? Dr. Hewlett was chief resident of Harlem. That's an honored position. I don't know what chief resident is anyplace else, but at Harlem Hospital, it's the baddest dude there, or lady. So I'm very glad that you joined us today. I do want to start off, before you start your official talk after Dr. David introduces you, I have a couple of slides I want to talk about that you certainly may comment on as an infectious disease specialist. Simon, put the slides up if you would. As you know, we've talked about mask issues from the beginning. Let's go to the next slide, Simon, please. So recent information shows that masking yields small reduction in COVID risk review. And surgical masks and N95 masks, the information was not particularly encouraging that much was obtained by them. Let's go to the next slide, Simon.
Did we lose you, Randall?
I can't hear him.
So this
I can't hear him either, Dr. Nabert Stevens. I can go ahead and read the slide though.
Hey.
Okay, masking issues. Use of masks in both community settings and healthcare settings may slightly reduce risk of COVID-19, but the evidence base leaves much to be desired. The final installment of a living rapid review of multiple studies found. Bullet number 2. The strength of evidence remained low for reduced risk for SARS-CoV-2 infection with surgical masks versus no mask or masks on the basis of 2 prior randomized control trials Oregon Health and Science had in the Annals of Internal Medicine.
So Dr. Maxey had a power failure. He's in the process of coming back on. This doesn't help the confusion that the public has and doesn't do anything to increase the faith in what we're telling them. I'm really curious to hear what Dr. Hewlett has to say about that.
Okay. Certainly. Should I get started?
Yes, please.
Sure. Well, first and foremost, thank you all for inviting me to come back to discuss these health topics. I always view it as a priority to try to pass on reliable, factual information to the members of our own community. And so it's always an honor to be called upon to do this. With regard to masking, what I can say is that although the general masking requirements in most public places, as well as in the transportation industry, have been relaxed, we still are noting in our healthcare facilities that the masking is something that we're doing. Personally, I think that it is an advantage for us to continue to mask. I know that I actually had debates with our own Commissioner of Health when they wanted to actually drop the masking completely. But I think that in our healthcare facilities, it is something that we still should be doing. I just went to visit my sister, who was actually in an emergency room in a short stay hospital just this morning, and we were required to mask there. And so I think that it is something that is still being done. I think that it is protective for individuals who may be immunocompromised, especially. And I think because we may actually have infections and we're in the incubation phase, we still might be passing infection on to others even before we are symptomatic. So I think certainly it is very worthwhile. The other things which we were looking at in the slides, I saw the term presenteeism and absenteeism. Many of us, in fact, I think most of us who are working in the healthcare field, and I think prior to COVID, most of us, I think, took on a rather stoic approach to our responsibilities to taking care of our fellow humans. And many of us, I think, would work when we probably shouldn't have been working because we weren't feeling well, because we had a flu-like illness, and we didn't realize how dangerous the situation might be if we actually were coming to work. I think that this past pandemic has made it very, very clear that we are placing our patients at risk and also our colleagues at risk if we come to work when we are not feeling well, particularly with a respiratory tract illness, but also even with gastrointestinal types of illness. One of the problems I think that we're facing is that we're between a rock and a hard place because we are understaffed in most places. And so we all are worried that if we don't show up, that our panel of patients isn't going to be taken care of. So it is a dilemma, but I think that we have to certainly start to use judgment when we are thinking about whether or not we're going to report to work. Certainly, we've advised everyone in our department, our clinical department, that they shouldn't show up. And one of the things which I think you should still know and that we should emphasize is that we are still screening people at the entrance to our health department in Westchester County. And in some of the hospitals, they're still doing that. That is, we're at least taking temperature screens to make sure that if someone is febrile, that they're not coming into our facility.
But Dr. Hewlett, I'm going to push on this. At the end of the day, should we, the common layperson, in our everyday activity, wear masks or not? And should we wear masks when we are traveling, especially on airplanes and in confined spaces?
Confined spaces. Yes. Well, I can tell you what I do. We know that we don't have laws that are requiring it on public transportation. But personally, when I ride the trains in the New York metropolitan area, when I take a flight, which I do rarely, I keep a mask on. My spouse keeps a mask on also. That's how we travel. And I think I would advise others to do pretty much as I would do, much the same as if a patient were to say, what would you do if it was your mother or your brother or someone close to you? What type of advice would you give? And this is the kind of advice that I would give in those types of settings. I do think that we can be a bit more relaxed if we're in outdoor settings, because I think it has been shown that transmission is much less likely to occur if we're in outdoor settings where we are able to have some space and circulating air. But that's pretty much the way that I look at it.
I'm not sure that Dr. Maxey made it back yet.
Okay.
So
I'm not back up on my iPad. Go ahead, Dr. Naaman Stevens.
All right, we're kind of going backwards. So at this point, even though he's already shared some of his expertise with us, let me formally introduce our speaker for the day. This is not his first time with us. And some of you may recall when he was here last year. Dr. Hewlett is currently the medical director of the Division of Disease Control and chief of tuberculosis services in Westchester Department of Health in Westchester County, New York. He is an esteemed professor at New York Medical College, Valhalla, and an infectious disease consultant in the Calvary Hospital in Bronx, New York. He is also a member of the NMA COVID Vaccine Task Force. He received his MD from the University of Wisconsin in Madison and is board certified in internal medicine and in the subspecialty of infectious disease. He received his internal medicine internship and residency training at Harlem Hospital. And as you heard Dr. Maxey say earlier, he served as the chief resident in his 4th year. He went on to complete his fellowships in infectious disease at Montefiore and Albert Einstein, and has served as infectious disease chief at Lincoln Medical and Mental Health Center in New York. We are so happy to have him with us because during this time of obvious heightened concern about infectious diseases that are circulating in our world, we value having the input from an expert. I thought it was important that as we approach and enter the summer season, that not only we review what are necessary steps that we need to take to protect ourselves from COVID, but there are a slew of other illnesses, many of which are vector-borne, either mosquito or tick or other vectors that are more prevalent during the summer months. And I wanted us to be made aware of what we need to be careful about, what we should be aware of, and what we should do if we think we are either going to be exposed or in fact have been exposed to one of these diseases. So without further ado, I will turn it back over to Dr. Hewlett.
Well, thank you very much, Dr. Naaman Stevens, and I also want to thank Dr. Maxey for that gracious introduction. And one thing that I will remind everyone of is one of the first people I met at Harlem Hospital when I was still a medical student, and a person who I shadowed around was Dr. Randall Maxey. And he doesn't remember that probably, but I remember it very well. And I think that people like Dr. Maxey were the kinds of people that inspire people like myself to want to serve in our community. And so I just want to put that in, but I'll be happy to speak with you about a number of these issues, including some of the tick-borne disorders that we have to deal with that people may not be familiar with. I think that we also want to try to say a few things about some of the vaccines, an update on the bivalent vaccines and where things are with that. And I think we also want to make sure that we touch on, as we're going into the summer months, the routine vaccines, so that people are aware of some of the dangers that are there, much more so than they were previously, because of where we find ourselves with a much larger segment of our population who are now unimmunized. So I think I'm looking forward to having essentially an open discussion on that.
So let's dive right in and talk about some of the diseases that you alluded to, the tick-borne in the in the Northeast and now also in the Southeast. I'm not sure, I should know better, but I don't know about the West. People hear a lot about Rocky Mountain spotted fever and Lyme disease and Western equine disease and Zika disease. So could you speak to some of those, please?
Yes. I think the important thing is that we should know that And maybe a lot of this has occurred because of global warming, that we are now seeing that these diseases are all becoming much more important. They are becoming much more prevalent. And I think also probably because of technology, we are able to diagnose these conditions more readily than previously. As far as one of the most common that has been seen is Lyme disease, which essentially got its start in Connecticut back in the 70s in Old Lyme and Haddam, Connecticut. There were a cluster of children who had arthritis, and they were thought to have had rheumatic fever, and that they developed arthritis from that. And of course, everyone thought that would be very, very uncommon to see that many children at that point in time with rheumatic fever. And they found that this was a brand new disease. And Lyme disease has become a very important disease for us during the spring and summer and early fall, not only in the Northeast, where things actually started in states like Connecticut, Massachusetts, and New York and New Jersey, but also it is spread into the middle Atlantic states, and also it is seen in the southern states as well. And as time has gone on, what we have found is that there are variants of this disease that are in most parts of the country, and there are certainly similar diseases that are seen in the western part of the United States, in California, and then there are tick-borne diseases that are seen in the Midwestern states. So the bottom line, I think, for everyone is first and foremost to try to prevent these diseases from occurring. Many of the diseases occur as a result of ticks that are either on deer, which is the case with Lyme disease, but we know that some of our domestic pets may also come in contact with these ticks that might be left on plants by the deer as they pass by. And so the pets can actually bring the ticks into our homes and can cause us to be infected and our children, grandchildren, and others to be infected as well. And we know that some of the diseases are caused by dog ticks. And so we have to be aware of this. The precautions that we can take is that during summer months, it has been shown that if we wear proper clothing and if we can limit the amount of exposed skin that we have when we're walking through areas that are grassy, that might be somewhat helpful.
Now, can you remind us of,
repellents may help it as well.
can you remind some of us city people what a tick is?
Yes, actually a tick, it's actually an insect. It's a small insect that will attach to the body, and you may not even know that it is there. It tends to actually suck blood out when it is attached to the surface of the skin. And some of these ticks are infected with a organism that we call, in the case of Lyme disease, Borrelia. And the interesting thing, Dr. Maxey, is that the same type of organism that causes Lyme disease is the kind of organism that causes syphilis. And so you can think of it, I think if one were to think of this in lay terms, it's almost like you're getting syphilis by the bite of a tick as opposed to by sexual transmission. Characteristically, people will within the first roughly 2 to 3 weeks, they will develop a rash that we refer to as erythema migrans. And it typically is an itchy kind of a rash, and it's red erythematous. It may be in a place that you don't really examine. And so for our children, you may find it in their armpits. You may find it around their navel. Years ago, I know my daughter had a tick bite, and it was actually in her belly button. And then all of a sudden, when we were getting her out of the bathtub, she was only about 3 years old, we saw this big red mark around her navel. And I knew that it was probably Lyme disease, and we got her treated. But I think it's important for us to examine ourselves and examine our children. The scalp is another place where we may have the ticks lodge and cause problems. And I will say that this is true not only of the ticks that cause Lyme disease, but the ticks that cause the other types of tick-borne illnesses in other parts of the country. And more often than not, you will see an initial rash and the itching or burning sensation. If we catch this early, then we can treat it with simple antibiotics. For adults, doxycycline, which is a tetracycline type drug given twice a day, usually for a period, I think, of anywhere from, I think we usually are going out to about 21 days, but I think 2 weeks to 3 weeks. Amoxicillin is also very effective, and even plain penicillin. And that's one of the things that we can do. If we don't recognize the early phase of Lyme disease, and this goes for some of the other tick-borne diseases as well, which we can get into, you may go into a secondary phase. During the secondary phase, the thing that is most frightening is that you can develop a myocarditis or a carditis. And we did see occasional patients over the years. One gentleman presented to us with complete heart block, and he was in his 30s. He was a jogger, and he got Lyme disease. He didn't recognize the first manifestations. The first manifestation for him was complete heart block and having a syncopal episode. And when the Lyme serology was done, it was positive. If we, this is one of the things that we may see, and of course, we may see the arthritis that can develop if we fail to recognize and treat. So it's important for us to recognize this, and it's important for us to try to prevent these tick-borne diseases from occurring. Another tick-borne illness, which is rather frightening when it occurs, is called ehrlichiosis. And that's also caused by a tick bite. And most of these disorders occur during the warmer months for those of us who are here in the Northeast, but I think that in other parts of the country, you may see it spread out over a longer period of time. Ehrlichiosis can actually cause a fairly systemic kind of an illness where the patient actually has manifestations of like just having an infection or sepsis almost. And it will cause the white blood cell counts to go down, and it can be a dangerous situation if it's not recognized and treated urgently. For those of us who are physicians who are faced with this, we try to get a good history from the patient. And I think it's important for patients and for everyone, if they do develop an illness that seems to be rather strange, if they have a strange rash, make sure to share with the doctor that you may have been in an area that was wooded, or you walking through high grass, or you may have thought that you were bitten by something. Also, it's important for you to add to that history whether or not you have pets, because that's also very important as far as the doctors are concerned.
So let's switch bugs and let's talk about mosquitoes.
Okay.
I find them particularly pesky.
Yes.
And I think growing up in the South, I'm used to living with mosquito bites all summer. But what should we be aware of? What should tip us off that this is not a regular old mosquito bite?
Well, these are the ones that really scare us because I think that everyone knows if we are going to be traveling outside of the country, if we are going to the African continent, if we're going to areas in South America and Central America where mosquito-borne illness like malaria is very well known and appreciated, we talk about the precautions. But I think now with climate change, some of these mosquito-borne illnesses, which we thought were confined to those tropical areas, we're now seeing here in the United States. One of the ones which I think has become prominent over the last few years is West Nile virus, which is of course transmitted by a mosquito bite. And this was something that was seen only on the African continent years ago. And now, of course, it is being seen in most parts of the United States, especially during the spring and summer months. What will actually tip us off that this is not a typical mosquito bite is that people will develop fever. They may develop neurologic findings, things like headache, severe headache. Sometimes they may start to feel fatigue. And if these are things that occur, you need to make sure that you consult a doctor as soon as possible, because although for many of these conditions, there may not be specific treatment, for most of them, we can at least offer supportive treatment so that we can make sure that the patient doesn't have complications. I saw something in the text, and I apologize for using the medical terminology for syncope. Syncope actually means fainting or passing out. And so I want to make sure sometimes I slip into that. But the West Nile virus is one of the very important ones that we have to think about. Another mosquito-borne disease that was discovered and described just a few years ago is the Zika virus. And it's a very important infection. It's important to know about this because it was associated with what we call a teratogenic effect. That is, it can cause birth defects if it occurs in a pregnant woman. So if the pregnant woman is bitten by a mosquito that is infected with this virus, with the Zika virus, this can affect their developing fetus. And there were terrible fetal abnormalities that were associated with this. And during the time when this was being described back in, I think it was like 2012, 2013, it was primarily occurring in South America. However, there were cases that were described here in the United States, I think primarily in the state of Florida, and there may have been a few other places where this was described. So again, prevention is one of the keys. Using repellents, insect repellents, is one of the things that can be done. Avoiding being out during the time when the mosquitoes are most active. Now, of course, it's easy to say that, but we know that the mosquitoes are more likely to be active during the period around dusk. And I think sometimes even during the dawn period as well. And they tend not to be as active as we get into the middle portions of the day. But you will probably recall about how during times when there has been West Nile virus activity, many of the municipalities have limited things like football games, which might be occurring during the evening. And they've postponed and had those games rescheduled to occur earlier during the day. But these are just a couple of them. The other thing that's very well known, and I think that everyone should be aware of this, every single patient and doctor, is that malaria is still very, very common, and it is very difficult sometimes to diagnose. It's very easy to treat, but if we don't recognize it, we can have very bad outcomes. And anyone who is traveling to areas of the world where malaria is endemic should actually receive what we call preventive therapy, prophylaxis, before they go. And depending upon the part of the world where you're traveling, you may have to have special kinds of prophylaxis. One of the things which I know we were talking about in preparation for this discussion is, where can people go to actually get advice on what types of precautions they need to take, and how can they get some of the things that they need to prepare them for international travel. And the health departments in most large cities do actually carry most of the things that you need. And most of them will actually have people who can counsel you in terms of, depending on where you're traveling. The CDC updates us in terms of what actually is going to be needed, what is most necessary. But malaria prophylaxis is one of the most common things. And we know that people with malaria will usually have fever, and it can be very high fever. And they will have chills, shaking chills, and it's sort of like a roller coaster. And if you have a person who has traveled to an endemic area and they have not had the prophylaxis, we have to make sure we recognize this. And I'll just say one more word about malaria. We have sometimes our colleagues and friends who were born on the African continent feel that they're immune to malaria. And so they will go back home to spend time, and they come back sick with malaria. And some of them actually are in danger of developing the most severe form of malaria, the cerebral malaria. So it's important for us to encourage our colleagues who are from the African countries and friends and family members that just because you were born there does not protect you from malaria. You have to take the same precautions that those of us who weren't born on the African continent have to take if we're going to be traveling there.
Dr.
Let's
Sheila, let me ask another
transition.
question. Can I ask
Let's
another
trans-
question, Ms. Neighbor?
Let's transition. You're talking about
Hold on a minute.
prevention.
Before you transition a minute, can I ask a question
Mhm.
regarding ways to avoid some of these ticks and also mosquito bites? What would you recommend in terms of commercial products that you can buy in terms of bug sprays and things like that?
You know, I don't know, Dr. Maxey, if there's any particular one that's preferable. I think that the products that are approved for sale in the reputable pharmacies are probably all reasonably good. That is the sprays that are available. I can't really say that one is going to be much better than the others. I do think, though, that you have to make sure that you utilize it, because if you don't use it frequently enough, then the effects of it on your skin will wear off, and so you have to make sure that you use it. I know this is kind of subjective, but the repellents are certainly very, very useful. The other thing I think with the ticks is making sure that you closely examine your children at the end of the day. If they've been out with summer activities, you know, look at them and examine their areas, especially under their arms and their scalp, even in the groin area, because that's where the ticks like to lodge. And you will often see like a little rim of red around the area where there's been a tick bite. But I think, as all of us know, for those of us who are of darker complexion, it's much more difficult to actually see this. And so we have to carefully examine these areas on ourselves as well as in our children.
Yeah, I have one other concern just to tag on. My children go down to something called tide pools in the ocean, and at the
Mhm.
beach. Are there any dangers there?
I don't know that it's any more likely in those areas than in other places. As far as the ticks are concerned, I think the ticks are going to be most likely to be found in the beach areas, in the grass that's around the beach. That's where you're more likely to find the ticks, as opposed to in areas like if they're like areas where you just have the water. Now, and with the water, then of course there are a lot of other discussions that we can get into there.
I wanted to add on the tick prevention, and pediatricians get into this a lot. So you want to be careful in how you remove a tick. You don't
Yes.
want to just grab it and squeeze it. You want to very carefully remove it from the head so that you remove the mouth part, which is very tiny, from the skins, and avoid squeezing so that you don't squeeze more of the bacteria into
Mhm.
the victim.
Yes.
There are other techniques, you know, that you'll read about, painting them with fingernail polish to smother them. That has plus minus results, but removing them with tweezers very carefully without squeezing them is
Yes.
something to keep in mind. And then as far as mosquito prophylaxis, again, from my Southern experience, but here in Florida, we receive notices every season to make sure to dump out any standing water, to make sure that you keep your grass cut down as best you can so that you eliminate the breeding places for these bugs, as well as what you advise in terms of the nightly check. And not just children, I might
Mhm.
add that, adults need to get themselves checked out too, because you can't always see them, especially from the backside.
Yes, yes, absolutely. I totally agree. Yes.
But I wanted to make sure we had time to talk about prevention of the of polio and so that you could give some updates on what's happening in this country as a result of the anti-vaxxers, as well as the update on the new COVID vaccines.
Yes, thank you for this opportunity. And I'll say a few words about all of the preventable infections that are now again on the rise. And you mentioned polio. Last summer, I believe it was almost a year ago in June, there was a case of polio, paralytic polio, which occurred in New York State. The individual resided in Rockland County, which is adjacent to Westchester County, which is maybe about 35 or 40 miles north of New York City. This individual had not been vaccinated. And unfortunately, when the paralysis occurs with polio, it's permanent. And there's not a lot that can be done once this develops. But this virus is extremely dangerous. And one of the things that is known about polio is that most of the people who get the infection do not develop symptoms. If they develop symptoms, they're very mild and they may go away. However, when a person does develop symptoms, it's such a small number that it's been estimated that for every one case of paralytic polio that you see, you actually have thousands of people who actually have the infection, and they are excreting the virus in their stool. And what has been done in the New York City area, which has been sort of a shock and a wake-up call to us, is that they've looked at samples of the wastewater, and they have found that the wastewater that's been collected adjacent to the county where this gentleman was living, Rockland County, and in 2 other upstate counties, as well as in all of the counties that were in New York City, which included Manhattan, Queens, Brooklyn. The polio virus has been found in all of those places. And so it's very likely that New York is not unique. You have other parts of the country which probably also are being affected as well. The bottom line, I think, is that we have to make sure that we are up to date on our polio vaccines and that our children are up to date as well. We are faced with a situation where we have a fairly large number of people who are coming into the country from other places where the polio vaccines may not be mandated. And the oral polio vaccine, which used to be given here in this country, which is no longer given because it actually will cause, can actually be excreted and can actually cause illness in some people, that is still being used in some of the other parts of the world. And so it's important for us to make sure that we've had the polio shots and that our children and others have had it to protect us, because there's been a second case that occurred during the fall, I think in September or October. Now, in addition to polio, the measles. The measles is something that we shouldn't be seeing anymore. And unfortunately, in various parts of the country, not only in New York, but there's been an outbreak that's occurred in Columbus, Ohio. And there have been some other places where there've been outbreaks. And in Columbus, Ohio, I think there were close to 90 children who were stricken with the measles. Some people may say, well, what's the big deal with the measles? The big deal is that if you happen to be unfortunate, you may develop encephalitis from the measles, which is essentially inflammation of the brain. This can lead to permanent intellectual disability and permanent problems with your ability to think, cognitive function, as we call it. And so we don't want that to happen. The other thing which occurs more commonly with the measles, which is also very dangerous, is what we call measles pneumonia. And we don't want that to occur. And so, although these are things that don't occur very often, by getting the vaccine, making sure that everyone around us has the vaccine, we can prevent those things from occurring. And so these are the kinds of things that we are starting to see now. And so we're at our health department, we are making an effort and doing outreach, making sure that we are immunizing the school children, the students, people that are coming into the country. We're trying to make sure that they have these required vaccines. And more recently, we actually have seen cases of the mumps. There have been clusters of cases of the mumps that have occurred as well. So we're hoping that we're able to speak with people. We know that many people have objections to the vaccines, and this is something that's not new. We can look back 30 years ago, there was an outbreak, a fatal outbreak of measles in the city of Philadelphia that involved a Black religious group that opposed vaccinations, and there were children, small children who died. I forget exactly how many they were, but these were essentially preventable deaths that occurred in an urban population. So this can affect all races and for that matter, all age groups.
And then did you want to speak to the new COVID vaccines?
Yes. And this is relatively new. One of the things that has come out recently is, of course, the bivalent vaccine. The bivalent vaccine essentially contains components that will protect us against the new Omicron strains that have been out there. Actually, they're not that new, but the older strains, what we call the wild strains, those are no longer circulating. And so the primary series, which most of us received, it protected us from that, the wild strain, but it did not protect us against the Omicron strain. And so the bivalent preparations will protect us against these new strains, the Omicron strains. So far, the uptake has been very poor. I think overall, there's only been about a 20 to 25% uptake across the board. And for children, for young children, it's been lower than that. The uptake among our African-American population has been lower than the norm. And this is really a missed opportunity. We want to urge everyone to avail themselves to getting the bivalent vaccine. And what everyone should know is that we no longer are giving the standard vaccines. The CDC recently asked all of the health departments and all the providers to more or less discard all of the old preparation and to basically only administer the bivalent preparation. And so if someone comes into us for the first time, they've never had a COVID vaccine before, they will get 2 shots of the bivalent vaccine. If they are immunocompromised, then we have to make adjustments, and they, of course, would receive more doses according to their needs. And we should keep in mind as well that the bivalent vaccine has been we're authorized to administer it to children down to the age of 6 months. So children from 6 months and on should receive that vaccine. And one other little plug, which I'll put in, Dr. Navras-Stevens, is that the respiratory syncytial virus, we're actually very excited about RSV and the new vaccine that was recently discussed. And it is going to be available for use in pregnant mothers. And what that will do is that it will protect their newborn for the first roughly 6 months of their life. I know there's some controversy about this, and I'm sure there may be some people that will want a lot more information about this, but I think that, not being a pediatrician, but I do know that bronchiolitis can be life-threatening in these very small children, and most of the bronchiolitis is due to the RSV, or respiratory syncytial virus. And so this is a very important breakthrough, and hopefully it will be something that will reduce the occurrence of this potentially fatal disease in young children.
So I have another question. I have patients come in and I say, have you been vaccinated against COVID? Yes, 2 years ago. What are we telling people that they should do to keep up current immune status?
Yes, thanks for that question. They should receive a couple of doses of the bivalent vaccine now, Dr. Maxey, because although it's great that they came forward and they got the initial doses, the primary series, as we called it, they're no longer protected against the Omicron strain. And although it has been shown that the illness that's caused by the Omicron strain seems to be less severe, it is important to prevent infection. And also, certainly we want to prevent the risk of transmission to others. So those people should receive a couple of doses of the bivalent vaccine.
So how often should we have it now?
Well, that's the jury is still out on that. What we have been told at our health department is that they meaning those that are looking at vaccines, they're looking at trying to couple the administration of the COVID vaccines that have been, let's say, updated with the administration of the flu vaccines. And so what probably is going to happen, I can't say with certainty, but what we've been told is probably going to happen is that maybe every fall as we enter the respiratory virus season, we will offer the updated COVID vaccine along with a flu vaccine. And the nice thing is that you can give these injections concomitantly to the patient, one in each arm. And there does not seem to be any problem in terms of an increase in adverse events. And there also, importantly, doesn't seem to be a decrease in the what we call the immunogenicity or the protection that you get when you give both of the vaccines at the same time.
Dr. Waltz, are you at the state fair, county fair?
I am at the fair, Dr. Maxey, but I am able to hear and get all this good information. Absolutely.
You have any comments?
I'm listening, and the question I have is, if someone comes in and they have not had the vaccine previously and they're still not interested in getting vaccinated, they say COVID is over, all the requirements are down, and I don't want to have the vaccine. How are you responding to that when you see patients, Dr. Hewlett?
Sure. What we've done at our health department, and this is an excellent point as well, is we try to figure out where we can meet them. And so we first try to impress upon them the fact that they're not only doing this for themselves, but they're doing this for others in their family and others in their community, because if they get infected, then others may get infected. The other thing which has resonated with some of the people in the community is we remind them of the importance of primary care and the importance of making sure that the chronic conditions that they may have are being adequately treated. We know, at least early on during the pandemic, over 90% of the people who were hospitalized and who died as a result of COVID, they died not just because of COVID, but they died because they had diabetes that was out of control. They died because they had respiratory tract disease that was not being controlled, or cardiovascular disease that was not being aggressively treated, or they had problems with weight and nutritional types of issues that could have been addressed. And so we try to emphasize the fact that, well, okay, if you don't want the shot, at least let me lower your blood pressure. At least let me check your A1C. At least let me get you to stop smoking. These are the kinds of things that I think we can do so that we're offering them something. And one of the things that we have noticed, and maybe I'm being idealistic about it, is that if the patient realizes that we're interested in them as a person and we want to do something for them as much as we can, as much as they'll allow us to do, rather than having them leave the clinic with nothing. We try to at least offer them something. So that's kind of how we have approached it. We haven't been successful with everyone, obviously, but at least I think if we can get people started with just thinking about the importance again of primary care. I think if this pandemic has taught us anything, it has taught us how important primary care is, and how important it is for people to be connected with physicians, and how important it is for them to follow the directions of the physician to try to optimize themselves so that they are better prepared when these threats come to us in the environment.
I just want to comment. That is so beautifully said. They will know that we care about the other things, because if someone knows you care about them and they begin that relationship with you, absolutely, it's much easier to give advice and to get compliance. So thank you.
Dr. Neighbor-Stevens, are there any questions in the chat or comments?
No, we have no hands raised and there are no comments or questions in the chat. I just want to thank Dr. Hulett for giving a very comprehensive summer guide, and hope that he will consider coming back in the fall and help us get ready for the fall winter season. Because I'm sure there'll be some new things that we will have to discuss.
Yes.
Like vaccines.
Down on the East Coast.
I know there will be, and I think one of the things we didn't touch on, but that we're trying to handle in our health department, are some of the issues around long COVID and the lack of support that many of our patients are receiving, and the reasoning behind that. So we certainly would welcome the opportunity to come back. I'm sure you're seeing the same things, Dr. Maxey and Dr. Walks, on the West Coast that we're seeing here, in terms of people with long COVID and their issues aren't being really addressed.
Yeah, I think the things I've read recently are that the cognitive decline is one of the big things that happens with long COVID. I know we're at the top of the hour. I want to give our moderators a chance to make final comments, and then I have a couple of announcements.
I
Dr.
saw there was one hand raised.
Who is that?
Dr. Sherrod.
Hello, Dr. Sherrod. Good morning. Good afternoon.
Oh, good afternoon. I just want to commend Dr. Hulett on an outstanding session. I have one
Thank you.
question though. So now that we have the bivalent COVID vaccine, how does that relate to, I just had a friend of mine told me she's going to Jamaica and she just got her booster. So was that the bivalent COVID vaccine that she got?
If she
That's
just got it,
Yeah,
should
she
have been,
said she
yes.
just got her booster. So is that
Hmm.
considered the booster now?
Yes, they've gotten away from the booster terminology. Now they're just giving the bivalent. That's pretty much the same for everyone, for the children, adults, everyone. So the practitioners, hospitals, clinics, health departments should no longer have the old version of the vaccine. They should only have the bivalent, either from whichever vendor it might be, whether it's the Pfizer or BioNTech or it's the Moderna.
Thank you. One other question I have for you, Dr. Hulett. I was actually on the advisory committee on immunization practices when we switched from the oral polio vaccine to the injectable polio vaccine.
Mhm.
And one part of that one downfall of that major switch was the fact that without the oral vaccine, you do not get gut immunity. And so it was predicted at that time that with the switch to the injectable polio vaccine, that we would see polio come back. So I'm wondering if part of the polio that we're seeing now is because of that change in recommendation. And what are your thoughts on that?
Well, I don't know the answer to all of that. One of the things that we do know is that they did document the strain that caused infection in this gentleman in Rockland County. And I'm not certain about the second, but the gentleman that presented in either June or July of last year. And it was a vaccine strain from another country. I forget which country it was from. It was from one of the European countries. And so it actually came from someone who had essentially probably excreted the virus in their stool, and then this individual came in contact with it. That was from at least from one of the cases. I don't know the details on the second.
Thank you so much, Dr. Hewlett.
You're
Thank you.
welcome.
Dr. Walsh, do you have any final comments?
My final comment is just I'm always interested in how when we get Dr. Hewlett, we hear about things that we don't hear about other places. There aren't health fairs that are talking about these kinds of infectious diseases as a big deal, and they are a big deal. And so I just really appreciate us being able to bring this information and Dr. Hewlett being willing to come and talk about it. This is in addition to the comorbidities that were mentioned. It's important to get that comprehensive primary care assessment from someone who understands that, yes, diabetes is a very important factor in our communities, heart disease, kidney disease, and what have you, and all of these other things that are just present. So I just want to thank Dr. Hewlett again for coming and talking.
Oh, you're
with us.
welcome. Happy to join. Thank you.
Dr. Neighbor Stevens?
Well, I too certainly want to again express my appreciation for Dr. Hewlett's willingness to share his expertise with us and help us to have a safe summer. And I think I'm going to end where I frequently end, which is there is no substitute for common sense. And as you move around, if you see that there are a lot of mosquitoes, then you probably should be taking steps to prevent infection. If you're going to be in the woods or in high grass, anticipate that you're in the critters' neighborhood. They're not in your neighborhood, and act appropriately, and hope that everyone has a safe summer, and we will see you again next week.
Thank you.
Thank you.
For my final comments, I have several things. Dr. Hewlett, you reminded me when you talked about malaria, how some of our relatives from Africa think they're protected from malaria. Well, I've been warning people to make sure when they go to their doctor or the laboratory that they get their urine tested for protein. There's something called a albumin creatinine ratio. And the reason that is so important nowadays, we have something called the APOL1 genetic variant from people whose ancestry is from West and Southern Africa, where there was endemic tsetse flies causing a pandemic of sleeping sickness. And that was maybe 3,000 plus years ago, but it has resulted in a gene variant that makes so many Black people have renal failure and go on dialysis, and you don't know it until it's too late. One early way to potentially know about it is to look at the protein in your urine. And there's as much as a 10 times increase in kidney failure from people who have this type of variant. So I urge everybody to make sure your doctor knows to not only check your blood, but to check the amount of protein in your urine. There's something that we can do.
Mhm.
The other thing is we recently signed a contract for Black Health Trust to have a new website and to be more outward looking. And I'm going to ask you for your financial support coming up that you can donate to the Black Health Trust. They're going to have a donate button and all of that. So I'd like to increase and improve our mailing list. So if those of you who are on and could have other people that you invite on, tell them not only are we on Facebook, not only are we on YouTube, but we're on these Zoom calls as well. And we need to improve and increase our mailing list. So if you would send us again, and anybody you know their emails, we can have them uploaded so we can increase our audience. So those are the things that are important. I hope everybody has a great Sunday, and we'll look forward to seeing you again next week. Thank you, Simon, very much for solving our communication problems. Thank you. Have a great Sunday.
Thank you.
Everyone.
What you- Yeah?
Yeah, and she was trying to